Hello friends, welcome to Creative Medicine. In this lecture, we will learn about
Cell carcinoma. Clear cell carcinoma is the most common type of renal cell carcinoma. So this clear cell carcinoma is mainly a sporadic carcinoma. It is the most common type of renal cell carcinoma and it is a sporadic type of carcinoma. So this clear cell carcinoma can include, there is both sporadic forms and the uh, hereditary forms are seen in clear cell carcinoma, and they are actually associated with the loss of chromosome 3. So in chromosome 3 there is loss of sequence, and this is mainly associated with either there is presence of either translocation is present, or there is either deletion is seen in the chromosome 3. In the chromosome 3 you will see either translocation of 36, 38, 311 is seen, or deletion is seen. This region which is translocated on chromosome 3, this mainly contains the gene VHL gene, that is von Hippel-Lindau's gene. That is the reason why clear cell carcinoma in most of the cases it is associated with von Hippel-Lindau's gene, and this clear cell carcinoma originates or it arises from the proximal tubular epithelial cells of the kidney, especially from the cortex. And in this clear cell carcinoma or renal cell carcinoma, it is seen as a solitary, that is single unilateral only one sided lesion with a pseudocapsule is seen, and this is formed, this tumor will compress the surrounding tissue along with compression of the surrounding tissue. Now if you see the tumor cells will look as clear, and they contain collagen. These are mostly well differentiated tumors. So they are well differentiated tumors with um, the following characteristics. Again, clear cell carcinoma is the most common type of renal cell carcinoma, which is sporadic in most of the cases, except that it can be uh, both sporadic or familial. These sporadic cases are mainly sporadic or familial cases, both are associated with loss of sequence on chromosome 3. This loss of sequence is seen on the translocation of 36, 38 and 311 and deletion. So in this chromosome 3, this von Hippel-Lindau's gene region is mainly affected. It mainly originates from proximal tubular epithelial cells, especially in the cortex. Clear cell carcinoma appears as a solitary unilateral capsule. When there is compression of the surrounding tissue is seen, and the tumor cells are clear with glycogen and lipids, and they are well differentiated.
thank you and thank you for watching.